All right, Dr. Henderson talking about the hydrocele procedure, what we call hydrocelectomy. So what that is, a hydrocele is just a big bag of water around the testicle. This can happen from trauma to the area and then it collects this fluid collection. It can be spontaneous. There's lots of different reasons for it, but it can be very annoying. Reasons to fix this is if it continues to stick around and doesn't resolve right after whatever incident may or may not have caused it. If there's a lot of dull ache or pain, or if you're always finding that you have to lift things up to sit down and it's very uncomfortable, get it taken care of. Don't wait. The procedure itself is very simple. We take you to the operating room. I make an incision over whichever side it is that has the hydrocele. Sometimes it's both, so we make an incision down the middle and we just pull out that big fluid sac. We drain the fluid out of there and then we actually cut any excess of tissue or sac that we don't need. And then we suture everything up along the spermatic cord so that we evert or flip the tissue up. Then when it continues to make fluid, because it will continue to make fluid, that fluid just gets absorbed by the surrounding tissue in the scrotum so that you don't get recurrence. Sometimes you can get recurrence if not enough tissue is cut and it can fold back down on and make another hydrocele sac around that. Again, like I said, the surgery is simple. Nobody cares about the surgery. It's very quick, 20-30 minutes, you're home same day. The recovery is the bad part about this. There's all this space and it's hanging down. So that's where all this inflammatory fluid or bleeding can go. So I tell my guys, there's lots of bruising, lots of swelling, lots of compression and ice to the area will help decrease the amount of swelling and bruising you get. But I tell guys, don't come and see me in 2 weeks, which is usual follow-up after most procedures. And the reason I don't want you to come and see me is you're still gonna hate me because of all the bruising and swelling. Come and see me in 4 weeks, and by 4 weeks, usually that bruising and swelling starts coming back down and guys say, okay, now I'm getting this normal scrotum back and I don't have this big bag of water in there. It's a good procedure, just you get it done, you go through the recovery of the 2 weeks that can be kind of bad. It's totally worth it to get rid of that and improve your quality of life. So good procedure. It's actually one of the first procedures I ever did as a medical student. At that time, I didn't even know I was going to do urology. So I like the procedure. It's simple, it's easy, it's straightforward, and not a lot of complications or issues whatsoever with any of my patients.